we're going to be breaking down and reacting to all the crazy medicine of Chicago Med. But before we get into it, if you're new to my channel, welcome. My name is Dr. Jordan Wagner. If you enjoy the educational reaction videos and other stuff that you see here on this channel, please smash that subscribe button and turn your bell notifications on. That way you learn when I post a new video. All right, let's dive right in. Oh.
Sir, can I see that for a second? Can I see that for a second?
If somebody has a head trauma like that, you're actually worried also about the C-spine injuries. If you smack your head and you smack back, you can actually cause a whiplash injury, and sometimes you can actually have like a spinous process fracture. They still do carry pagers, or nowadays it's kind of your cell phone. Different hospitals have protocols. At any one time, there's only a couple ER docs that are working, and then sometimes there's only one trauma surgeon, so you actually need to pool your resources.
He keeps biting down. I can't get the blade in.
This patient is in a C-collar, having difficulty with an airway, and he's using a laryngoscope, which is a blade, so you can actually put an ET tube.
Look, you bag him, I'll do CPR.
He's talking about bagging him using a BVM or a bag valve mask. The issue with that is it's not a definitive airway, and you're also putting air into the stomach as well, which then can inhibit blood flow back. If you can't intubate and the patient needs you to breathe for him, you have to cut open their neck. You're cutting through the cricothyroid membrane and shove a tube in. It's a bloody mess. It's going to save somebody's life. You have to do it. Oh, they're doing CPR. Okay.
Almost there. It's not time yet.
The guy doing the bag valve mask or the BVM's doing it like every second. Don't do that. How many times do we breathe a minute? 12 to 20 times a minute. People get excited and they just start pumping air. You just need to pump every 5 seconds or so.
Already hit him with the EPINEPHRINE. Still no pulse. He's in fib.
He hit him with Epi 2. What does that mean? He had 2 separate doses of epinephrine and doing CPR in between. There's 2 shockable rhythms, VFib and VTAC. Asystole, PEA, those are not shockable rhythms.
Get a BP and keep giving him blood. Get his blood gas and get him to the OR.
No gag reflex, didn't even need sedation.
If you don't have a gag reflex and you're not paralyzed or sedated, that means that there's some injury to the brain, decreased oxygen at that time. We don't know the outcome in that specific situation, but typically brain death, it's hard to determine. You can check pupils, that sort of thing. Definitively, it's over a couple days. I was doing an ultrasound.
This woman's pregnant.
So in trauma, somebody comes in, we use the ultrasound, we do a test called the FAST exam, which is the focus assessment sonographic in trauma. You're looking for fluid around the heart, fluid around the spleen, and fluid around the bladder. So they were probably doing that, and then they found a pregnant woman. You want to do your best to save the mother, save the child.
20-year-old male, cystic fibrosis, complaining of chills, labored breathing, temps 98.
Cystic fibrosis is a genetic disorder. Over time, increases risk of infections, limits how well your lungs are actually functioning, and could actually potentially kill you.
Now, Mr. Dilson, I see that you're using inhaled antibiotics, tobramycin, albuterol. You wear a vibration jacket at night and use a humidifier?
So the cystic fibrosis also has to do with a lot of secretions. So that's what they're talking about. The vibration vest to basically help get that stuff out and get things moving. They're stiff, you got mucus in them, they're not able to clear things out, increased risk for getting sick and pneumonia often, hence he's inhaling antibiotics and taking bronchodilators to open up the lungs.
Is she gonna be okay? And the baby?
Baby checks out fine.
Yep, good.
Healthy heartbeat, amniotic sac and placenta are intact.
So pretty good. ET tube is actually that plastic tube coming out of the mouth is actually probably a little too long. It's usually going to be a little bit shorter depending on the size of the individual. This looks like more like a type of an Aspen collar, so there must have been some sort of cervical injury. The vital signs on the machine look pretty good. A little tachycardic, a little hypotensive, but it's actually to be expected in a pregnant woman, but also to be expected in eventually a trauma patient.
Gina, though, I'm afraid suffered a traumatic head injury. And so far she's unresponsive.
Yes. And I'm seeing that there's a ventriculostomy tube chilling, so there must be a lot of swelling to the brain, not knowing if there's blood. The neurosurgeon bores a hole through the skull and puts this little tube into your lateral ventricle on the opposite side of the problem. So basically you're draining out the CSF to allow more space in your skull so your brain can swell a little bit, because if you swell in a confined space, it's going to cause more issues.
She's gonna be okay.
I can't promise.
Then you have the issue.
What about the baby? It's too soon to deliver,
Yeah.
isn't it? She's only
Yep.
24 weeks.
Yes, the baby needs more time.
There's a potential of the baby surviving, but the baby needs to be in the hospital for a long time in a growth container. So the optimal position is to continue to have the baby grow, but then I wonder if this could get into the issue of if the person is totally brain dead, you keep the individual alive long enough to get everything that they need grown for the baby and then take the baby out.
Are we gonna lose our child too? Oh my.
No, Miss Donahue, I'm not saying that. And I'm not giving up on Gina. But if the worst did happen, it might be possible to keep her on life support long enough.
I've done this
for the
once or
fetus to become
twice,
viable.
but it becomes
So
an
what,
interesting
Gina just
medical
becomes a-
legal problem.
Got your test results back. I wish they were a little more encouraging. You're pancytopenic, which means that your cell counts are low.
That basically means your bone marrow is not functioning.
You've got a blood pH of 7.14, which means
I know.
you
You're trying to adjust so you can blow off the CO2 to increase the pH, meaning making it go to like 7.2, 7.3, getting a little bit higher.
I'd like to intubate you, put you to sleep, get you on a ventilator. You're getting fatigued. This would just allow you to rest so that the antibiotics can do their job.
I've been intubated 8 times. I think I'll skip it.
We get in these situations a lot where somebody would benefit from being intubated to allow their body to relax, allow the machine to help and give a break. But in this situation, the kid's been intubated 8 times and just doesn't want to do it. We were always taught, and it's a very good rule of thumb, that you want to intubate when it's a controlled setting. So if you get to the point where the kid automatically then stops breathing or just quickly decompensates, it's more of a rush situation. It's not optimal.
Gina's intracranial pressure is rising. What does that mean?
You said that she was getting better.
Well, she is, and that her function was improving. But the swelling of her brain is getting worse.
Yeah, so they want a hyperventilator to get the CO2, having to do with brain swelling as well.
If there's any hope of beating it, I need to get him on a ventilator now.
There we go again.
You heard what he said. He doesn't want that.
Oh, we're past what Jamie wants.
You know what, Doctor? We're actually not past what Jamie wants.
Yep.
Kid has been so brutalized his entire life. He has a right to say no.
As long as somebody is of sound mind, you explain the risks and the benefits of all that you're doing. It's the patient's decision of their own health.
Intubating Jamie is the only hope we have of keeping him alive.
What's that going to give him? A week? 10 days?
Every doctor wants to help and do what's best for the patient, but sometimes doing what's best is actually doing nothing. So this patient has a debilitating disease that only basically can be fixed currently in this situation by a lung transplant, but the doctor's saying, well, let's buy him more time.
Rachel? Rachel, can you hear me?
What is wrong?
What's happening with
What's
Rachel?
happening?
I can't find a pulse.
Oh,
Oh my God.
why is the kid pulseless? Solid go, start CPR, shake the person, check for responsiveness, check for breathing, check a pulse. If you don't feel a pulse, call for help and start chest compressions.
You're not compressing the heart, Sarah. You gotta go harder.
But she's so small, I don't want to.
Harder, do it. Let's go.
You gotta compress further down to squeeze the heart. If you only squeeze down this far, you really gotta compress the heart. Nice.
Come on,
good.
Sarah, harder. Hold. There we go. Back inside. Let's get a BP.
What happened?
She arrested. We got her
Nice.
back.
Good. Best situation to be in. So if CPR can get the heart back, then we know that there's something potentially easily fixable. Versus if you're working, giving epinephrine, doing shocks, all these different things, then it's really hard to get somebody's heart restarted. Then you know you're in a situation where the long-term outcome might not be favorable. Kids, most of the time, arrest due to respiratory issues. So they're a little bit different than adults.
Hand me a drill, get an IO line.
They put an interosseous IV line in, so that basically goes into your bone marrow. It gets drilled in. You can give all the normal meds that you need to give into that area. And basically, hopefully, you give enough volume, then it plumps up the other IVs to get better access somewhere else.
Good job.
I just broke a little girl's ribs.
That's normal.
Reese, you saved the girl's life.
Probably not doing CPR deep enough if the ribs aren't broken. Once the ribs break, then it's a lot easier. It's just a weird feeling. They are C-looking pieces of bone that are attached to the sternum that you need to break down.
The crash victim I've been treating has died. He's a match for Jamie.
Let's get him some lungs.
Only thing, his fiance won't give consent.
If somebody passes away, we do find out and ask if the patient is an organ donor.
Without new lungs, he will die.
Wait. Sí. A él hubiera gustado eso. Yes.
So that was pretty intense, and the emotion behind it. Super rare that it would happen, super rare that this kid's getting a lung transplant. I'm glad. I've never seen the show, but this is like really good, pretty medically accurate. If you guys really enjoyed me reacting to Chicago Med, definitely gotta check out this video right here. And as always, make sure you subscribe, turn your bell notifications on, like the video. Thank you so much for watching, and stay healthy, my friends.